During EECP therapy, the patient lies on a treatment table with large blood pressure-like cuffs wrapped around the patient's calves, thighs, and buttocks. The EECP treatment is timed to the patient's heartbeat. While the heart is at rest, the treatment cuffs inflate in sequence from the calves to the thighs to the buttocks. Just before the next heartbeat, all the cuffs deflate at the same time. The squeezing action of the cuffs increases blood flow to the blood vessels that supply the heart muscle, increasing the amount of oxygen-rich blood being delivered to the heart. When all the cuffs deflate at the same time, the amount of work the heart has to do to pump blood out to the body is lowered due to a decrease in the resistance to blood flow. For many patients, completing 35 one-hour treatments of EECP therapy may result in the recruitment and/or enlargement of small blood vessels, known as collaterals, that can increase the blood supply to the heart muscle, decreasing their chest pain, fatigue, and shortness of breath. There is also evidence that other major organs, such as the kidneys and the brain, receive additional blood supply.
ECP is a very popular treatment all across the United States of America. In India, we are doing ECP and it's a US FDA approved treatment. The results are excellent. There is no cutting of the body. The costs are low. It avoids bypass surgery, angioplasty. So, this treatment should become very popular. Many heart hospitals like Medanta, Medicity in Delhi and Asian Heart in Bombay or Ambani Hospital in Bombay or Madras Medical Mission in Bangalore, they have already got this machine, ECP machine, but they don't want to promote it. And why it should not be promoted? That's what I was thinking. Let me give you a reason why they are not promoting. See what happens. The ECP is a very low cost treatment. One session of ECP takes only 2,500 rupees, and if suppose a hospital like Medanta they use it, they have to have a room for that, they have to have a doctor and a nurse attending the patient, and it costs them about 1,500 rupees. So only for 1,000 they don't want to do an ECP. So whenever the patient comes, they say, okay, you go for bypass surgery, you go for angioplasty. And then there are some patients who have already taken 2 bypasses, 3 angioplasties, 5 stents and all that. Then they don't know, what to do next. So now the cardiologists, they have no other option. So they say you are a no hope patient. No hope means we have exhausted all our means. Now there is no hope for you. So you go for ECP treatment. That means a person who is having severe disease can take ECP, and somebody who has got not so severe disease, they cannot go for a ECP treatment. That's looking absurd. It does not appeal to my mind. The reason that I can only tell you is financial. A bypass surgeon will get 2, 3, 4 lakh rupees easily out of the patient, and in a day an angioplasty will also get the same money, but ECP will only be 1 or 2,000 for the heart hospital, so they don't encourage it. This is one of the reasons this treatment should have been the first line of defense, that look, you follow the lifestyle in medicine and still don't improve, you go for ECP. But ECP is not being used by the cardiologists, by the heart hospitals, because it does not give them a lot of money. It's a cheaper version of the treatment, so they want to make money, and this is one of the major reasons I find ECP is not getting promoted by the heart hospitals. I believe good sense will prevail, and people will have so much of awareness. Gradually they will ask for the doctor that, look, I don't want to go for a surgery, I don't want angioplasty, let me do lifestyle change, medical management and ECP.